How do you structure a therapy session? As seasoned therapists, that's not something we think about very often, but I've been doing this for about 15 years and I just go through the motions oftentimes and I go through our routines. But the longer you're in this field, the more you develop your own systems, right? Systems for how you do therapy notes, the systems for how you do your intake assessments, and your own style for how you structure your therapy sessions. But it's an important thing to think about because when you've been doing this a while, it's something you kind of take for granted. But since this channel does cater to the art and business of therapy, I thought it would be a good idea to maybe touch on this point, as a lot of new therapists coming out of college, grad school, maybe might feel a little anxious about this part of therapy. Where do I start? How do I start a therapy session? What does that look like? Should they all look the same? So we're going to answer some of those questions and we're going to walk through it today. Okay, so I put together some slides. We're just going to walk through kind of my process. This is just how I have come to structure my therapy sessions in the 15-ish years I've been a therapist and what works for me. I should say that it's not necessarily what works for everybody or with every particular clientele or population you're working with, but I found this to be a good general structure. But as we're talking, if you have any feedback, any words of wisdom for the MHT community, please do jump in the chat and provide your suggestions, your tips, tricks, what works for you as a mental health professional, so that we can all benefit from that. So thank you so much. So we're going to go ahead and jump in here. Let's see. Oops. All right. So how to structure a therapy session, or I should say how I structure a therapy session. It's, again, a very personal thing, but as we walk through this, we'll just kind of touch on some of the things that come to mind as I was thinking about it. So the first thing to do is understand that your session starts before your session ever starts. And by that I mean you need, or should, I should say, get in the habit of reviewing your notes before you jump into session. Now, I personally like to do this for the day. Like if I know my calendar of clients, let's say you have 6 clients, or even in county work, sometimes 10 clients scheduled back to back, it would be very helpful if you review all of your charts ahead of time. And in my case, I will actually get my portfolio out because I handwrite my scratch notes. I know some people do notes with the client, right? Conjointly typing and such, but I personally prefer to handwrite my scratch notes when I'm with a client, and then I only type notes when I'm doing my intake, because I feel like it can interfere with your rapport that you're building with the client and being able to help them feel like you're being fully present. So that's just my personal preference. But what I'll do is, as I'm reviewing my charts for the day, I will actually take the time to put some notes on what we discussed last time, key things to consider, themes we touched on, homework, that kind of thing. But it should only take about 1 to 2 minutes per chart as you're going through, and I'll actually just on my legal pad and my portfolio, I'll just outline on each page. I'll flip through for each client. Plus, if I have a no-show, then I can just skip that one later. But as much as you can, get ahead of it, because you never know what your day is going to look like. You don't know. Hopefully it goes according to plan, right? But things happen. Crises come up. Sometimes you get a walk-in or unscheduled client that pops in, and it's weird because in this profession it almost always magically happens. When you have a no-show, then you have another client call in crisis or drop in. So it's weird that way. But oftentimes your day doesn't go as planned, and you may not have time later to go and review your charts ahead of time. And then that starts you off on a funky foot. If you jump into session and you haven't reviewed your notes very well, then sure enough, there's going to be something that you forgot to follow up on. And it's not a good feeling. So as much as possible, try and get ahead. If not the morning of, the day before, at the end of the day, kind of prepare for the next day. That's good practice. If you can get in the practice of doing that, I find it to be very, very helpful, and it saves you a lot of time later. Because you're already in the zone, you're already in sync with the client before you start your session, and that also allows you more time to do your therapy notes after your session, and not stress as much about reviewing for the next client. So I found that to be very effective anyway in the work that I do. All right. So moving on. Okay. So take the time to review your charts before your sessions. So that includes, reviewing your treatment plan, obviously what you're wanting to work on, what was discussed, key factors, that kind of thing. Key points discussed last session, but also consider continuing the previous thread versus exploring new directions. And we'll talk about this, but it's important that you're not too rigid, right? You don't want to jump in and say, okay, this is what we're working on today. It's more for you to kind of know what the roadmap is, so you can gently discern whether the client needs to continue with where you left off, and oftentimes they need a reminder. I know I don't even remember what I ate for lunch yesterday, let alone what we talked about last week if I'm the client. So it's important that we provide that structure for them so that they remember, oh yes, we did talk about that. And you can say, hey, is this important to you today to talk about, or is there something more pressing? What's going on? And I'll walk through the structure of that with you here in just a bit. All right. So after you've reviewed your notes, the second, I think, top of mind thing is to make sure that your therapy environment is set up in such a way it's welcoming, it's warming. You got that feng shui, you've got, gives that client the Zen feeling. But mostly what we're talking about is hospitality, right? Hospitality is not something you want to overlook. And I understand in some client work, you may not have the option to do that, at least not to the degree that you would like to, right? Sometimes you don't have the resources available to you. Sometimes it's the work setting. Sometimes you're field based and you don't always have the ability to provide the niceties, right? But even if you're out in the field, you can do what you can provide, even if it's just little pocket tissues or something you can take with you. But whatever you can do to help the client feel that you've thought about them and their needs in advance, it goes a very long way, just like it would for anybody. Think how you feel when somebody is considerate of your needs before you walk in the door, right? It makes you feel very good and cared for. So it's important. My pet peeve is tissues. I worked in a county clinic for 13 years, and my pet peeve was always tissues. And we would have shared therapy rooms, and I would go out of my way to stock each room with tissues ahead of time for the week, for the month, and whenever they'd run out, like, where's the tissue? Like, nothing is more of an oxymoron than having a client crying in your office because you're scrambling for tissue. That's not the moment you want to be thinking about, hey, where's that tissue box? It's one of those little things that go a long way. You want it to be a forethought, not an afterthought, right? So that goes back to the hospitality. When we are preparing for our sessions, structuring our sessions, always make sure you have backup, because sure enough, someone's going to, take it down to the last tissue before the prior session, and then you're going to have somebody falling apart and they grab the last tissue out of the box and you're like, oh, where's that other box of tissue? And it can really mess with the flow, right? Once you're in a flow of therapy, it can really mess with that. So we want to make sure that we're thinking about those little things. They go a long way, right? So it's about the hospitality, the comfort, the setting, the arrangement of your furniture, what makes sense for you, what's comfortable for you, also what speaks to the needs of your clients and makes it easy to engage, right? And factoring in your personal preferences, proximity to clients. Do you prefer to be at a big desk and have them on the other side? Do you prefer to remove those barriers between you and the client? Are you doing couples work? How much space do you need? All of those little things go a long way. And this is true too for virtual sessions, right? So if you're in a virtual session, you may not be able to provide them tissue, but you can help coach your clients to think about these things ahead of time. Hey, do you have water that's accessible? Be sure to hydrate, because, talking is thirsty work. Now, I say that kind of jokingly, but seriously, talking is thirsty work. And it's important that you think ahead and you make sure that your clients have something nearby to hydrate, as you do too, right? You don't have a coughing fit in the middle of session. All right, so here's just a little example in one of the therapy spaces I work in. This is my therapy office where I work, and I make sure that I work with a lot of teens, so I make sure I have a lot of the fidgets handy, things that they would enjoy and appreciate that will help them feel more at ease at home. In the background here, you'll have a mini fridge where I always keep cold water. That was another pet peeve of mine, is I always want to make sure, when I worked in the county clinics, I didn't have a fridge to, keep in the rooms, but I always had water I would bring with me, before I called the client into the therapy room. And it was very important to me that I offered them water. I offered them some kind of candy, or for me in particular, I've always been really fond of Andes mints, and it was just kind of my thing, my trademark. And I'd always make sure my clients have, offer them something like an Andes mint and a water or something to help them feel welcomed. Again, when you're building rapport with clients, that goes a long way. Plus, it becomes something they expect, and it's a creature comfort, right? So another thing you can think about, like where I work, I also, have different types of fidgets, whether they're magnets, fluffies, um, squishies, things that are tactile and give them different ways to help them feel more comfortable. Plus, as they're focusing on something, it helps them kind of unlock and calm down, unlock what they want to talk about. So I find that to be very useful, even with adults. They have little fidgets and things like that, like this wooden fidget cube I use. Uh, and weighted blankets. You can't see it right here, but in the background I have like a weighted blanket. Those are really good for anxiety. They're about 20 pounds, 15 pounds. Can really help with calming down if you're in a distressed state. So if you have any interest in checking out what I have put together in terms of what I use day in, day out with my therapy clients, fidgets, weighted blankets, fountains, diffusers, things like that, you can check it out on my Amazon idea list if you want. Here's just kind of a little preview of some of the stuff I have on there, including couch, chairs, work bag, fountains, rugs, as well as some of the equipment I use. Wall art, what you say stays in here, mandated, reporting, that kind of stuff. The mini fridge I use, I love. It's a great little mini fridge. So just some of those stuff, if you have any interest, be sure to check that out in the QR code. Just thought you might be interested in that. Sometimes people ask, and hey, where'd you get that? So there you go. If you ever wonder, it's there. I'll keep adding to it. Just a little FYI. Another thing, we do cover the basics when we're in a physical brick and mortar place. We want to make sure as much as possible that the room is soundproofed, that we're taking the client's privacy seriously. But also when it comes to virtual sessions, we don't have as much control over those things. So we want to make sure that clients are aware of the need and the importance of privacy, and they're thinking about those things so they don't end up being in a kind of a funky situation later with family or somebody overhearing or eavesdropping. We just want to make sure that we're doing our due diligence to educate the client on those things, especially if they're new to therapy and they haven't really thought through those things. A lot of people double up in apartments, or don't have that personal space. Maybe they have a car they can go to, or in some cases they may want to go for a walk while they talk to you, or in the backyard. Whatever you can do to kind of have that conversation to make sure that they have that sense of confidentiality and privacy. It really helps them also feel cared for and appreciated. Okay. Location. Clients should always give you their, location if it's virtual, if it's telehealth. You want to double, triple check that every session. Make sure that, hey, are you home right now? And you can tell, right? If they have the same background after a while, they're in their room or they're in their car. But you always want to double check if it looks like they've shifted spaces or it's someplace new. Sometimes if they have the background blurred or they have their camera off, a lot of clients are anxious or sometimes paranoid and they don't want their camera on. So you always want to make sure you double check, hey, what's your location? And you can ease into it by just reminding them, hey, this is for your safety. If something happens, if you have a heart attack or a medical emergency, I need to know where to send people, right? In the back of our minds, we're thinking too, if they want to hurt themselves, then we need to know where to send help, right? And also proximity to emergency resources around them. If we know where our clients live, obviously doing telehealth and that kind of thing, we want to be cognizant of, hey, what's the nearest hospitals to them? What's the nearest psychiatric hospital to where they're staying right now? And we can have those things at the ready. So in the notes and the charts, wherever. So we're already thinking ahead about those crisis situations. But that's a big one when we're talking about location, as well as the the tech check at the beginning of each session, making sure that their audio is working, their video is working. Hey, can you hear me? I can hear you. Everything is copacetic. Everything's working as it should with the technology, because it never fails that when you think everything is going to be smooth, you're jumping into a session and then the microphone doesn't work, or the camera's not working, or they can't hear you, or it's jittery. There's an echo, right? With telehealth, there's all kinds of pros and cons to it, but that goes back to, you don't want to rush in last minute to a session, especially telehealth, because that's the time something will go wrong. That's the time something will not work right, and you're running a session late and you got to fix it, and it just ends up taking more time. Case in point, I had a session yesterday morning, and everything was working fine, but all of a sudden my Mac wanted to do a update, and so then it was taking its time, and I had to text my client or message them and say, hey, I'm going to be a few minutes late. Sorry, my computer is doing an update. Just a reminder, I'm typically all set up at my battle station here beforehand, but I didn't that day. I just assumed it would all fire up fine, and of course it didn't. Murphy's Law, right? So don't make any assumptions on that front. Always give yourself a little time to ease into things. Encourage your clients to do the same. Make sure they log in, check in a few minutes early, and make sure they don't have any issues there. Okay? So starting the session, this is paramount, making sure that you're on time, right? What's that saying if you're on time or late? So that goes back to not just preparing ahead of time for your sessions, but making sure that you are all set up, ready to go, geared up before the session starts, right? Because the last thing we want to do is send the message to our clients that they're not important, right? We want to make, nobody wants to feel that way, or that there's other things that are more important than them, or other clients that are more important, right? If we're rushing in, and life happens, right? Once in a while, you can't help it, but in general, do your best to make sure that you are on time or early for every session, right? It's really important that we get in the habit of that, and we don't send the wrong messages to our clients that they are not important, because that's really going to hurt your rapport over time, and then they'll probably quietly quit therapy. They won't even oftentimes bring it up. So, try and avoid that by doing your best to be on time and punctual. Simple, but important. We kind of touched on this, appropriate niceties. I put a picture here of chocolates or whatever those are, because that's, important to me. As like I said, my thing is Andes mints, whatever works for you, lollipops or candy or whatever. But I think it's important that we have the little things to show that, we're trying to make it as comfortable as possible for our clients. Okay. But your personal style, you do you. Like I said, I'm known for Andes mints. Bottled water, snacks, room temperature. I have in my office, my therapy office, I have a little heater and an air conditioner and a fan, just so I can always check with them. Hey, are you cool? Are you warm? Like, would you like the fan on or off? Just taking 10 seconds to consider what their needs are and what makes them comfortable, right? Okay, weighted blankets, fidgets, encourage hydration, and of course, always do a safety check. Hey, just, I know you seem good, just gonna double check you're not, having any thoughts of hurting yourself today, and I don't need to worry about you, right? In addition to all the mood checks we would typically do. But that's a pretty straightforward one, right? Danger to self, danger to others. Obviously doing a mood check for depression. It's good practice to do your outcome measures every session. That'd be like your PHQ-9, your GAD-7 for anxiety. If they have PTSD symptoms, you could do the PCL-5. I always like to start off intakes with those, plus the OQ45.2, because that's a good global measure in terms of like life satisfaction, quality of life, gives you a lot of good data. But definitely, the basics every session, mood check, safety check, risk factors. Those are pretty structured, basic things you would want to do, right? And I created a handout for you as a free handout you can download. It gives you the full checklist for all these things as you're preparing and getting the habit of developing this clinical skill and structuring your sessions and making sure you're not forgetting any of these important things, because at first, coming out of college, it can seem like a lot. all these things I have to remember. But as a new therapist, it's handy to have a checklist. So I created one for you. It'll be in the description link as well as pinned in the comments. You can grab it there um, anytime. Okay, so let's continue. So going back to what we were talking about before, it's important to think about, as you're preparing for your session, you want to remember the themes, the things you talked about previously, the open loops, the goals, the treatment plan, but not to get too married to that, right? We don't want to be too rigid in our sessions. We want to make sure that we're giving the clients an option. Hey, so this is what we talked about before. These are the things we touched on and left off with last session. And I would like to spend some time talking about A, B, and C. These seemed really important. I would like to close some of these loops. What is important for you today? What would you like to talk about? And this could be after your mood check, right? This could be before your mood check. It's up to you. You'll develop your own style. I will typically do my review, my mood check, and then I'll ask. I'll say, hey, this is the agenda. This is what I would like to touch on. This is what you said was important before, or even 3 sessions ago. I would like to circle back to this. How's that going? And then what would you like to make time for today? What's important to you? And so you're offering, it's not like black and white, but you're definitely letting them take the lead and say, hey, free association, I would like to talk about this, or this really eventful thing happened. So and you'll find that as long as you're cognizant of these things, the session will, unfold as it should, where it needs to go. But you just want to make sure that you're not missing anything important, or you're you're holding that for the client too, so they don't forget what's important to them as well. Okay, but flexibility is key. So it helps to maintain a consistent structure in your sessions, not just so you don't forget what's important, or so you don't veer too far from the treatment plan, right? Or if the treatment plan needs to be updated, that's something you do. But also because a consistent structure for clients helps them feel taken care of. It helps them feel safe, right? When they check into the session, oh, my therapist, Patrick, is going to, recap last session, and he's going to ask about my mood, and he's going to ask about the last time I saw my psychiatrist. He's going to ask if there's been any medication changes. He's going to ask about the homework that we talked about last time. And then he's probably going to ask me a couple more times how my mood is, because I always ask 3 times in 3 different ways. And the reason for that is because we have to kind of break through that initial socialized response. How are you? Good. Oh, how was your week? Okay. And you keep going, and eventually you get a real response. Oh yeah, and this happened and that happened. Oh yeah, and then oh yeah, I didn't sleep good last night. I've been having recurrent nightmares. Oh yeah, and then I got in a fight with my spouse again. And so it's important, but they get used to that, right? So they like that structure, and it really helps you. It helps them to maintain some sense of structure without being overly rigid. Okay. But also cues for transitioning. And you can, you want to make sure that you don't rush on to the next topic too quickly, right? So you don't want to just go through it I created a checklist for you, but you don't want to go through everything like a checklist with your client. You want to make sure you're giving everything breathing room, and you don't want the client to feel rushed to go through things, and you're being mindful of the time. And you can remind the client, hey, okay, so it looks like we have 15 minutes left. These are a couple things you touched on last session. Did you want to revisit those, or focus on continue this discussion, right? So you're helping to kind of be the timekeeper for the client and making sure that there's an allotment of time for the things that they haven't touched on or they would like to revisit. So hopefully that's helpful. But that's part of transitioning, is you're giving everything breathing room, but you're also being the timekeeper. Okay, so creating the agenda, right? I'm a certified cognitive behavioral therapist by the Academy of Cognitive Therapy, and part of that certification process was they really drilled into us the CBT session structure agenda, and a lot of that is making sure that you are giving the client an opportunity to create their agenda while you also express your agenda, and you almost assign a certain amount of time or importance to each of your agendas in the therapy session, so the client feels like they are getting the best use of their time. And this is important, right? Especially for self-determination and buy-in. We're talking about progress and those things, as well as risk factors and just doing our diligence, right? But this is where reviewing the chart's really helpful. As you're creating your agenda, it's going to include things like your last session date, key points from last session, last visit with a psychiatrist, if they have a psychiatrist, do they need to see a psychiatrist? Do they need a referral? Medication adjustments, therapist agenda items, things you would like to follow up on. Oh, you've been seeing the doctor for, your primary doctor has been giving you Prozac for, seems like a while now, but sounds like you're still at a, maybe a starting dose. How do you feel about a referral to a psychiatrist, right? That's something you can make an agenda item for yourself. Or maybe it's group therapy. Have you considered groups or whatever it is, whatever therapy item? Oh, you want to revisit some of their childhood, something you want to revisit in your intake that maybe you didn't deep dive on, right? These are just things that you're thinking about that you could approach the case with, right? In your case conceptualization that you'd like to move forward with, right? Client agenda items, what do they want to work on? Obviously, what do they want to work on today versus their overarching goals, right? Sometimes those might seem different. A lot of times they're just related, but in ancillary ways. So don't make sure you're giving the client the freedom to steer, in that direction they want to go. You're taking time to review outcome measures, right? Ideally we would be doing them every session, but at least every few sessions, just to kind of track how they're doing over time. Gives you a lot of good information, because then you can ask follow-up questions. Oh, I noticed that you scored higher in this area than you did last session. What's going on here? Is anything triggering you in this? Or in my case, I love to do mood scales, right? So I'll do mood scales with clients, and that helps them to track their mood on a scale of like 1 to 9, 1 to 10 each day. And then you can kind of explore contributing factors, their strongest emotions around those events, how they interpreted those events, their thought process, as well as their coping behavior, right? What do they do with what happened? How do they cope with it? So mood checks are helpful because it gives you a lot of information throughout the week that they would have otherwise forgotten. A lot like journaling, just quicker. I have a free mood check tool you can grab in the library if you want. All right, so agendas are helpful. I also like to note recent stressors, homework review, and then of course planning for the next session is important. So as you're buttoning up every session, you want to be kind of thinking about, okay, what do we want to pick up with next session? Homework are you going to give the client? It doesn't have to be like hardcore physical, like mood scales and that kind of thing. But it could be something very simple, right? Oh, make sure you practice your deep breathing like we talked about, or take that 15-minute walk that you committed to, the little things. If it's panic disorder, maybe it's a habituation scale, right? You're revisiting, hey, how did that go for you? And where are we at with that? So that's more or less the structure. When I talk about the structure of a therapy session, it's kind of the bookends. It's the top is the review and the follow-up, and the end is kind of planning for that next session, right? And everything in between is where the session goes, right? Which may have absolutely nothing to do with where you thought it was going to go, and that's fine. But this is how I bookend my sessions, and that really happens when you review, right? And you're very familiar with the case. And again, I think it's very important to review your charts right before the session, because you don't know if something's going to happen, and then you're going to be scrambling to review your notes, and then it's not going to come off the same. It's not going to have the same energy as if you had the time to mindfully review your notes when possible. Okay. All right. In addition to these, some other considerations, right? Active listening, just being empathetic, just being present with your client is paramount. That is the most important thing, regardless of how you choose to structure your sessions or what interventions you choose to implement, or what modality you tend to prefer, right? The important thing is that you're present, you're using that active listening, and you are making sure that you're holding space for the client. However you do everything else and you find your style, and you're obviously taking care of the main things, it's really important that you're just present with your client, and that you're using nonverbal cues to show that you're engaged and you're listening and you're understanding, getting clarification when needed. And you will develop a personalized approach for each client, because none of this stuff is boilerplate. When I say I give you a template or a checklist, it doesn't mean that this is going to, every session is going to be cookie cutter. It's, again, just giving you a very kind of skeleton structure, bookends. It's going to really help your flow, but your therapeutic relationship with each client is unique, and no case is ever the same, which is the beautiful thing about therapy, because no person is the same. Everybody's entirely unique. So hopefully you'll find that to be the case, and you will feel less anxious or stressed about these things as you get used to the therapeutic process. Okay. It helps too to develop, little mindfulness exercises and things to help your client ease into the session, especially if you feel like they're especially anxious. That's also where the hospitality comes in. It helps bring them down, especially if they come in worked up or anxious. But whatever you find to be useful in the way that you build that rapport with clients. If you're not comfortable leading guided meditations, you can, just give the client a few minutes to do some deep breathing on their own, right? Whatever works for you to help them ease in. Additional considerations, obviously set clear boundaries and expectations, your availability, how sessions are structured, how they can contact you. Definitely discuss the length, frequency, cancellation policies. If they'll be charged for late cancellations, and this is more applicable to private practice than like county work or that kind of thing. But always talk about boundaries with clients. This is a lot of that's done at the intake, right? That would be the informed consent, right? Dual relationships and that kind of thing. Make sure you provide periodic reminders of things like mandated reporting, limits to confidentiality, just because sometimes things come up, or if you see that the client's sharing something that might go in that direction, just give them a kind of, a refresher before they go further with those things. It helps. It's thoughtful. It's considerate, right? You would want someone to do that for you. And, when you get into this field of therapy, what's as important as being present for your clients and understanding and being a good therapist in the sense that you're structured, you're prepared, you're on time, is managing your own junk, right? So that's where we get into things like countertransference, right? Understanding what's going on within yourself, and if something's triggering you, or if you have your own implicit bias that's getting in the way of effective therapy. It's important that you're cognizant of those things and you're checking in with yourself. Or if you're having a hard time changing hats, when you're bringing your emotional work home with you, those are things to consider, because if you aren't aware and cognizant and doing that reflective, introspective work as a therapist, then you will run into problems like burnout, right? Because you're not taking care of yourself and you're holding on to all this stuff. So if you burn out, you're no good to anybody, right? So it's very important that you're thinking about how you're taking care of yourself. And a lot of this is the reason that most therapists have a therapist, or they're having some kind of supervision or consultation or professional consultations or groups, so that they can bounce cases off each other, even in a confidential kind of way, team meetings, clinical meetings, case consults, right? So that you have that kind of support. Very, very important in this field, that wherever you find yourself doing this work, that you are finding a way to get that support. Another really important thing, when we talk about structuring therapy sessions, is the not so fun part of things like documentation, lag time, making sure your notes are done ASAP. I have a rule: I try not to get out of my seat until the note's done. Everybody has their own system. Like a lot of the doctors at the clinic I used to work at, they would book the end of their day to do all their notes, and they just wouldn't see any patients during that time. I prefer to do my notes between sessions, as opposed to, there's no risk of them stacking up that way, as much as possible. And I'll try and schedule my clients with 30 minutes of downtime between, so that I can take care of those odds and ends, as opposed to doing them back to back to back to back. And then you have like 10 therapy notes at the end of the day. I don't think that's very fun. So I try and do them as I go. Plus, it'll be a lot faster because everything's still fresh in your head about the therapy sessions. So you won't have to go back and look at your notes and task switch, which is not very effective because you're doing double the work to kind of remember what you talked about and where you were at. If you're already in the headspace after a session, it'll be far easier to do your notes. Far easier. Just food for thought on that. So as far as administrative stuff, make sure your lag time is good. You're not letting notes, get too far out. It is a general rule. 48 hours is the limit, pretty much. I know sometimes things happen and they stack up, but as best you can, try to handle your paperwork in a immediate time ASAP manner. And any kind of payment issues at the beginning and ending of sessions, right? You don't want to avoid those conversations. If you see that a payment failed with a client, that's something to address pronto and have a discussion about it, a loving discussion, and walk through it with them, and don't avoid those tough conversations, right? Because then otherwise it becomes a disruption to the therapeutic process, right? And we're trying to remove and mitigate anything that would disrupt the rapport with our clients, because that is where the work is done. Healing takes place in the context of the relationship with clients. It is not about the modality necessarily that you're using. That's a small factor. It's actually the relationship, the therapeutic relationship that lends to healing. So if you allow things like missed payments and you're avoiding the conversations to interfere with that, that'll damage the rapport. Okay? Always be prepared for crisis situations. Have your emergency protocols in place. Know where the client is, know who their emergency contact is, know where the nearest psychiatric hospitals are, etc. Okay? And always have your local resources and referral options available for clients as needed. All right? Always keep educating yourself in this field, right? That's what we want to all be good therapists and help clients. It's important that we are staying in the know of what's working, what's best practice, etc. And that comes with CEUs, but also seek as many opportunities as you can to stay educated and sharp in different areas, even if you don't feel like they necessarily apply to you now, because you never know what's going to be an unlock later for something, right? Or where you'll find yourself. In this field of mental health, there are many, 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 many doors and different careers you'll find yourself in, and you'll, as much as you have on your tool belt, the better, right? The more you have, the better, because you never know where you're going to be and how you're going to be of service to someone else. So if you have an opportunity to learn. Practice self-care, please. I'm a huge fan of power naps. So make sure that you are taking time to take care of yourself, fill your cup so that you can show up as your best self for others, for your family, for your clients. And that's going to come through self-care. If you burn out, you're no good to anyone. Okay? So maintain that as much as you can, that work-life balance. If you find that you're struggling there, consult, get supervision, get your own therapist if you don't already have one. Get a gym membership. Figure it out. Okay, but self-care. Make sure that you're engaging in activities that prevent burnout and compassion fatigue, and structure systems to reduce your stress as a clinician. That's why I'm making this video, because it's important to have systems. I have systems. If you want to learn more about my systems, please let me know. I feel it's important to have systems, and that keeps us all safe. There's one of my favorite quotes. I think I heard this from Sean Cannell. One of my favorite quotes is, "We don't rise to our goals, we fall to the level of our systems," right? So if you don't have a system in place to help you tackle your goals, then you're going to find yourself frustrated a lot of the time. Okay. So in conclusion, we talked about how to structure a therapy session. We talked about how to prepare for a therapy session beforehand, as well as the ancillary things that come with that. But if you haven't learned how to conduct an intake assessment, right, then that would really be the first thing to do, because knowing how to do a therapy session really comes after you learn how to formulate a case, how you conduct an intake assessment. But yes, all of the other things are important: hospitality, structuring a session, preparing for a session. All the things we talked about today are the principles of therapy and getting positive outcomes, right? So if you want some of the handouts we discussed today, I created a therapy session checklist for you. you can just scan this QR code. The link will go in the description. I will also pin it in the comments so you can grab it there. It's a free little checklist I threw together based on the things we just covered. Okay. I also have a progress notes template. I use it every day for my notes. I know a lot of EHRs you can type right into. I use therapy notes for my private practice. I use other EHRs for my other jobs and stuff, but I still type my therapy notes in my Word document on the same template I created and I've used for years and years and years, and then I'll copy and paste it into whatever EHR I'm using, right? I use it like a canvas, and that works for me. That is my system. If you would like that, I created a free handout for you. You can grab it, steal it there, get a Google Docs copy, whatever. I like it. It works. I still do GURP. I'm not a fan of soap. Some people love soap. Some people are trained in soap. I love GURP. GURP is what I do. It makes the most sense to me. But you do you. But my template is in GURP. If you are thinking about private practice and you haven't made that leap yet, or you're starting a group practice of your own or whatever, I haven't made a video on that yet, but I will, on how to start a private practice. But I'm a huge fan of therapy notes. I'm also an affiliate. So no cost to you, but if you use my affiliate link, you get the first month free, and it's my absolute favorite EHRs. I have probably used, at this point, 7 different EHRs, and Therapy Notes is by far, hands down, my absolute favorite EHR platform. So if you want to check it out, if you use my link, thank you very much. But really, even if I didn't have an affiliate link, I would say go with Therapy Notes. They're easy. Customer service is phenomenal. I've never had any issue getting a hold of anybody. The billing is a pinch. I mean, since you just click a button, billing's done. Super simple. I love everything about Therapy Notes. I couldn't be happier. It really does make private practice a breeze. So anyway, that's my speech on that. If you want to check it out, feel free if you're in the need, or if you know anybody who's starting a private practice and would be interested. So please, if you appreciated this chat, make sure that you please do like the video, subscribe to the channel. It pushes it out to more people. I'm really trying to help new therapists learn the art of therapy, and as well as seasoned therapists learn how to scale their experience and help more people in a way that they love. So please let me know. If there's anything I missed, anything you want to add to the conversation, please do leave a comment. Please do share this video with anybody that you think would benefit, would be helpful for. That's why I do this, just to be helpful. So like I said, links will be in the description, pinned comments, etc. as always. And like I said, if you haven't really mastered the art of the intake yet, then this conversation is kind of moot, because the most important thing is to have a foundation of a really good intake assessment, because that becomes the foundation that all of your therapy sessions will draw from, right? The better structured your intake is, the more information you have there, the less you'll have to backpedal and dig up later. So it really is important to get comfortable with doing a good intake, because that becomes your blueprint. It's not something you really want to skimp on. A lot of EHRs try and now with AI and everything, will try and make it easier on you. I still feel like doing a good, thorough intake assessment in an old school way is going to give you a real leg up in the work you do with your clients. But that's totally up to you. If you want to check out my video, I did a whole video on how to conduct an intake assessment. In fact, it was one of the OG videos on this channel. It's one of the very first videos I ever made. It's still one of my best performing on the channel. So don't judge me too harshly. It was like 5 years ago. But if you want to check it out, there's the QR code. It's how to structure an intake assessment. I also have an intake assessment template you can grab off of that video as well. So with that, I hope you really enjoyed this little chat. I did, and I put some time into really thinking about how I could structure it in a way that would be helpful for you. So if you enjoy this video, I'm glad, because that's why I'm here. So please do share it with anyone that would benefit. And with that, I wish you all a fantastic week.